Are you suffering from numbness and tingling that runs down your neck, all the way down your shoulder, into your arms, goes into the hand? It can be the thumb, the middle finger, or even the pinky finger. This can happen if you're having neck pain or you have some sort of nerve entrapment going down your arm. So, what we're going to talk about today is what's exactly happening, how to diagnose it, and then how to fix this. I'm Dr. Jake Deasy. I'm a physical therapist and certified personal trainer. And I'm going to walk you through what I use with my personal clients. I help outdoor adventurers, hikers stay pain-free and on the trail. And this is something that comes up a lot, especially when we start loading on a heavy pack for those multi-day backpacking trips. So let's get into it. So first, in order to figure out what exactly is going on, we need to diagnose the problem. You can diagnose this by doing a series of nerve length and mobility assessments. This will then determine what you need to work on and then will lead you to the appropriate treatment. What we need to look at first is if you have any numbness and tingling, where exactly is it? Is it in our hand? If it's in my thumb here, that's different than if it's in my middle finger and my pinky finger. So determine where most of the numbness is, and if it kind of comes and goes, pick and choose where the most numbness is, like on average. Okay, so say it's my thumb, kind of runs down the forearm here. It doesn't have to run down the forearm, but we'll say it's in the thumb. This is going to be mostly your radial nerve. Radial nerve is C5 and C6 of the cervical spine. So that means that you might have something going on, not always, but you may have something going on in that kind of middle to lower part of your cervical spine. Now, there's a certain test that we can do to determine whether or not you might have nerve symptoms or decreased mobility going on there. Here's how to assess that. So what you're going to do, I'm going to stand up so that you can see it better, but you can do this sitting or standing. It doesn't matter as long as you're consistent. So you're going to take your hand, rotate it in. So see that? I'm taking my thumb, rotating it in. I'm going to close my hand and make a fist like that. So I'm clenching it up. I'm bending. I'm not only clenching my hand, but I'm bending my wrist down. So I'm rotating in, fingers together, and wrist is down. Then I'm going to extend my hand and rotate it the same way that I brought my fingers in. So everything's kind of rotating that same direction, and it should look twisted like that. Okay? So think of like I'm sticking my hand in my pocket and I'm twisting it around, but now my fingers are clenched. Okay? So see if you have any numbness and tingling going on there. Then what you do, take your other hand, secure it onto a chair if you can, and add in some neck motion. So you want to go in the opposite direction of your hand. So if I'm using my right hand, I'm bending my head to the left. And notice I'm not rotating my head. I'm not turning my head at all. It's just taking your ear to your shoulder. So that motion there. If you get an increase in symptoms in like that first finger, maybe even half of your second finger or down in there, you may have some decreased nerve mobility of the radial nerve. Now, if you have numbness and tingling going into the first kind of 2 to 3 fingers, this may be the median nerve. So the median nerve comes from a little bit lower on your cervical spine. The radial nerve was C5, C6. This one is going to be more C6, C7, essentially somewhere in there. Everybody's anatomy is different, okay? So the way that you test this to see if you're having decreased nerve mobility is you're going to once again be sitting. So how you do this is essentially you're going to make a waiter sign. So imagine I'm sitting in a chair again. I'm going to take my other hand, brace it on the chair so nothing moves. Take the hand that you want to assess, and then you're going to put your arm up so that it's at a 90-degree angle here, like this. So not, this is 45. See if you can get your arm up to a 90-degree angle. Now, you want this to be completely in line with your your torso. You don't want it forward or backward. So it's hard to see from this angle, but it's straight 90-90 here, but also not forward or backwards. So next, what you want to do is I like to focus on the elbow first and work our way out. Straighten elbow, then you're going to take your thumb and you're going to rotate it so that your hand is as flat as possible. So your thumb is going out. Then you're going to add in extension of the wrist and fingers. You may notice numbness and tingling here in the forearm with this already. So you may not need to do the last section, which would be adding in head motion. So if you add in head motion like this, notice again, I am just tilting my head. You may notice more numbness and tingling. That would be a positive sign to show that you have some neural tension going on in the median nerve. And if you have neural tension in either of these, it doesn't really matter. It's something to work on, but it doesn't necessarily mean that this is causing your pain or your numbness and tingling. But what I do want you to pay attention to is, like, say we're doing this and I already feel it. I don't even have to add in my neck. That means that my median nerve is pretty tight. Now, if I add in any sort of neck component, then maybe the neck is something that I want to treat a little bit, because if it's really ramping that up or making it worse, then it might be coming a little bit more from the neck. Maybe you have just tight musculature, you have to loosen that up, or you have, thoracic outlet syndrome where something is kind of pinching on the nerve, causing you to have some of these increased nerve pain symptoms. So last but not least, we're going to talk about ulnar nerve. This is like if you had any numbness and tingling in the pinky. So in your small little pinky finger, you're going to take and make like an okay sign, and then you're just going to basically turn it around and make that same 90-90 position, turning your palm up towards the ceiling. You may feel some numbness and tingling in the pinky going down into the forearm already. And then if you need to, your hand is braced on the other side, tipping your head straight over, and see if that increases your symptoms or not. So, a positive test would be creating numbness and tingling in that specific area. You always want to test the non symptomatic side first if possible. So, if my right arm is the one that's numbness and tingling, I'm going to do it on my left side so that I have a baseline or something to compare it to. And then you do the symptomatic side so you kind of know what to expect, but also it's going to give you something to compare to so that you know maybe you do or do not have decreased nerve mobility on the side that is causing you pain. So that's really important step. Don't forget that. So now that we did those assessments, we may know what's actually going on and what's causing your pain, what specific motions are exacerbating that nerve pain. So in order to treat those symptoms, we actually do the same motions that we did to test it, but in a controlled manner to treat it. So if you have radial nerve symptoms in the thumb, you do that same rotation, kind of curling the fingers behind you, and then you can add in head motion to just glide that nerve just using your head, or you can get it so that you feel nerve tension, whichever way that may be. Whether it's, say, you don't need your head, you're just getting your hand in that position and then you're pulling it out. And then you're putting it in that position and putting it out. So it's this position, arms curled, and then out. And you're just flossing that nerve in each of those positions. Same thing with the median nerve. We're up here, we're extending our elbow, we're extending our wrist. I feel it there, so then I just go off, and then I turn it back on, and I go like that. So the advanced way is you can add tension by doing both at the same time. This is advanced, where I'm adding in my head as I do the motion. That's going to give you the most neural tension pull and stretching out that nerve the most, but this may be too much from you if it is, very severe. So we want to keep this nerve pain definitely under control, because nerve pain is not something to mess around with. If you do too much of these, it's not like any other exercise where do more, it's better, right? We want to do just enough so you don't flare it up and make it worse. Because if you do too much, you're going to know and you're going to feel it. So it's one of those things where people ask me, did I do too much? I don't know. You'll know. Nerve pain, you'll know. It'll be able to tell you. So you want to be able to feel like a slight discomfort, kind of numbness, tingling, burn. You want to recreate that with this. That's normal. But you just want it to be comfortable. And after you do it, it may linger around for a little while, but it should go away after a couple of hours, potentially, as soon as a couple minutes. You would do 10 reps of these, potentially 2 to 3 times per day. Can add in our head. And just make it a rhythmic motion. So you're going on and we're going off. And we want to do it really slow. So like this speed here. 1, 2, 1, 2. Like I said, you don't need the head. You can do 1, 2. Kind of like that speed there. Nice and slow. All right. So that's how to assess your nerve pain, figure out where it may be coming from, neck, or is it coming down the chain, and then how to treat each of those specifically. That's really detailed. If you guys are experiencing any of this, please go ahead and leave a comment. Tell me your story. It helps me out tremendously. Not only know what to talk about and what you guys want to know, but also it gives me a way to reach out to you. So if you comment, I will try to comment back, and we can either get in touch through email, or I'll send you a link so that you can do a Zoom call with me. I do a free strategy call for all people. This allows me to further assess what's going on, give you the steps that you need to move in the right direction. I don't want people getting caught up in the healthcare system where they just go see multiple specialty doctors. You're just wasting time and money, when in reality, as a physical therapist, we can help you assess this pain and treat it through exercise and education. So I do provide online training. So it's rehab coaching as well as training for an adventure. So I help people get out of pain and then train for whatever goals they have, whether that's to get in better shape, lose weight, get fit, and train for your next hike, improve your balance, improve your endurance, but also get out of pain if you're in any pain, and do those adventures without any fear or anxiety that you're going to get hurt or something's going to flare up. So if that's you, if you are training for your next adventure, or you just want to enjoy your daily life, please feel free to go ahead and click the link in the description. It's going to set up a link where you can book your call, a free call, and we can go from there so that you can get the life that you're really looking for. So go ahead, check out the description in the comment section below. I'll make sure to put a link in there. As always, you guys, I hope this was helpful, and we'll keep creating content for training and injury prevention and rehab of injuries so that you guys can stay pain-free and on the trails. I hope you have a great day. I'll see you in the next one.